Hi, I'm Wendy. I'm one of the nutrition and dietetics staff, and we've been using ePortfolios, in particular PebblePad, for the last 3 and a little bit years now. So a little bit of history. We have a 2-year master's degree. It's competency-based development. Our first year students spend the year mostly in the classroom, but it's a bit of skill base and a bit of knowledge base that they're learning. Our second years then spend the year outside of the classroom. They do a semester of research, which is a straight 13-week semester, and they have 20 weeks of clinical placement, which is spread over usually around 4 different placement sites. So we cover 3 different domains of dietetics in doing that, so it's quite varied in terms of what they do. And traditionally, our assessment that we started with PebblePad was based really just around these placement sites. So to start off with, we just had paper-based, and that was pretty messy because it was a tick-the-box system. It was often just done in a rush at the very end of placement. Wasn't particularly good in terms of learning or engaging the students in their own learning and their own competency development. What we wanted to do was to engage them in the whole process so that we really made them think about setting goals and strategies, directing their own learning and directing their own outcomes, and understanding what it actually meant to be a dietitian. So after our last accreditation, we were advised that we could no longer use those paper tick boxes. We could have used another one, but we had been using the same form that the other 4 universities across New South Wales and the ACT doing dietetics were using. So towards the end of 2012, I had been speaking to another of our staff members about this new PebblePad that was around, and he'd been trying it in biochemistry, and it worked okay, but it wasn't particularly purpose-driven for that. But when he showed me, I thought, well, that could actually work really well in dietetics. So towards the end of 2012, I was a clinical educator, still mostly out on site in the hospitals, and I started with 4 students, and there was 2 that started at one hospital site, and they split over 2 then and then came back together and swapped over. So I had quite a hands-on approach with them, and we trialled the PebblePad, and with them, instead of me doing all their assessments, asking them to put their reflections onto PebblePad. And it was really interesting in doing so. I had a couple of students who weren't very good at verbalising what they thought or being able to give you feedback on their progress at the time. What I found was when they did it on paper and then I got to read it remotely at a different time from them as well, that they had very, very good insights into what they were doing and what they needed to do in terms of moving forward and addressing the competencies. And that, for me, was the first real win, that we could get some engagement and communication with students who maybe don't think so well on their feet and who really need that time to step away, think about what they're doing and put it on paper rather than giving a quick answer. So that was our first win. What we then did was to roll it out across all of our students on half of their placement in the second semester that we trialled it. So this was semester 1, 2013. And that was interesting, and we've hit one of our first challenges, and that was trying to make sure that our supervisors understood what we were trying to do. And it was messy and time consuming, and as we then went across the second semester, became even more so. We have 60 students over the year. We have over 100 different sites that they go to, and we had to train students and the staff in doing so. But at the end of the year, we still decided that it was a really good thing to do, and we've kept it up since then. We've moved on to a newer platform, we've tweaked what we're doing, and we're moving forward. And what we're planning on doing next year is to embed it across our entire curriculum. So this year we started off with our first years in second semester, giving them a little bit of a taste of it. Because most of our students come in and they're not, they're science students, they're black and white. They like to sort of set out problems and solve them, but they often don't think about their own practice. And we're moving them from a very science-based type of learning to a reflective practice base as they develop their skills. And it takes quite a deal of time for them to come to grips with thinking about their own practice. What do I need to do? What do I need to change? And it also takes a little bit of time for them to think about actually using the platform and getting familiar with it. So this gives us a semester with them at university first. And we found that's really quite useful. And so we're starting to look at their competency development. We're using the same forms we'll use on placement, and they're starting to get a portfolio together. So next year, we've got new competencies coming in from our accrediting body, and we're looking at starting at week 1, year 1, and using the competencies so that the students get very familiar with those, and it's embedded right across the curriculum. So we're in the process of mapping our assessment tasks to our new competencies and selecting the key assessment tasks that might demonstrate a student developing certain parts of those new competencies, and they will be included next year in our new documents that we're going to do. So what are we trying to get out of this? We're looking at 2 things, and I think the reflective practice one has probably come out already, that this is a lifelong learning skill. This is something that is at the very heart of our professional CPD. So once they leave here and join the Dietitians Association, they want to become accredited practicing dietitians. Reflective practice is at the core of that. So we're teaching them professional skills, and it sets up that lifelong learner attitude. So, okay, I look at what I do and what am I going to do better. The other thing we're trying to do is to flip assessment on its head. So instead of it being that traditional supervisor or lecturer-led assessment, getting the students engaged in their own learning, engaged in their own assessment, engaged in thinking about how they improve their practice is a much more effective learning strategy than us saying tick, 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 yes, you did this well, no, you need to work on that one. So that's at the core of what we're trying to do. So we've had a few challenges along the way, and the first one is that the platform is not perfect, but it's the best one that we've seen around for what we want, and doesn't have all the functionality, but it's getting better as we go on, and next year we'll go to the new version, which is HTML driven, so hopefully that will solve a few more of the problems. I think the biggest issue is training our assessors and our supervisors. Many of them are a little bit changed out. The hospital system has had a lot of change over the last few years in terms of using technology platforms, and so it's just another thing to do. A lot of them only have 1 or 2 students a semester, so that's certainly an issue as well. So theoretically, this is a good learning process for all of us in terms of not just the students but the assessors as well, to become more familiar with those competencies and their own practice and be reflecting on that as well. One of the other things is that it does take a lot of time to set up. It takes a number of days to set up, and we have no admin support. There's not really any way around that. But that's a secondary issue to everything else, and I think the opportunities and the benefits outweigh that. Some of our students are a little bit technophobic, and so are some of our supervisors, but in this era our grads need to be comfortable with learning new technologies and flexible to be able to do that, and that's engaging them in that additional part of what's going to be common practice once they leave here. As I've mentioned, some of the students are not naturally good reflectors, so that's been a challenge, and embedding this across the program gives us a full 12 months to work with them to get those skills up and to get them thinking about their practice and improving. It is a different way of thinking. That mind shift from a supervisor-led assessment to a student-led assessment is quite big, and it is taking the supervisors quite a lot of time themselves to wrap their head around. So traditionally, often they would maybe do a little bit of an assessment halfway through, maybe a 5-week block, and then final day they do all the tick boxes. What this is asking them to do is to allow the student to come to them with some evidence and say, look, I've put some evidence in, I think I've actually nailed this competency, can you have a look at it, can you maybe sign it off? And that can happen any time throughout the 2 years of their placement. And that means the supervisor does need to be able to stop what they're doing at some stage or make a time to sit down and do that. But it also means that the student can then go, well, I've got that one, I know I need to keep working on it, but that can then help frame the things that they really need to work on as they head towards the end of their placement. So that different way of thinking for the assessors is probably one of the biggest hurdles we're facing. In terms of opportunities, I think these outweigh all of those challenges. It's the engagement of the student in their own learning, and that's a fundamental win. It's rather than the spoon feeding, it's them making it happen. It's developing graduates who are independent, that are self-driven in their own learning, that are critical thinkers, and that are able to problem solve and assess their practice and set goals and strategies for lifelong learning. There is a development of a portfolio of work, and this is pretty exciting when the students come back to us and go, you know what, I found that really hard going through placement, but now I'm applying for jobs, I've got all of this evidence, it's all in the one place, it's all together, and making the job applications has become a whole lot easier for them. And so I've had a number of them independently come back and tell me that that's been a real win and that they did get a lot out of doing this. So as I said, the portfolio is the basis of forming goals and strategies. Our grads have that mentoring year the first year up, and so often they can use these with their mentor as well. At the university end, it gives us clear evidence for our accrediting body of appropriate and adequate training to an acceptable standard, all in the one place. And we have 2 reports, checklists, we've got probably another 20 or more forms, 4 reflections on placement, which all used to be in paper. And we work in a supposedly paperless office, and it's taken all of that away. There's no more chasing up, you haven't submitted this. The students had to bring them into the university, even if they didn't have to come in for any other reason. So it's made that a whole lot easier for everybody, and it's all on hand when it gets to accreditation. So in 2016, integration and embedding across the curriculum will allow our students from the start of the course to develop skills and consider the breadth of skills and knowledge that they require as a practicing dietitian, and really make their learning very engaged and very much self-driven.